England's first national child gender reassignment clinic is being sued by the mother of a patient and a psychotherapist who used to work there. They claim that experimental treatments used on children as young as 11 have not been researched enough. They're asking the court to ban the Tavistock Centre from prescribing hormone-blocking medication unless the court decides it's in the child's best interest. They also accuse the clinic and the trust that is in charge of gender identity services in North London of giving families misleading information about the risks of treatment. Marcus Evans, a psychiatrist who worked at the clinic and the husband of the psychotherapist suing the facility, argues that the treatment is indeed under-researched.
You know, it's a controversial treatment with a vulnerable group of kids. It's got long-reaching consequences. We really don't know what's going on in this area, and yet the trust was acting as if there was nothing to look at, everything was fine, and we just carry on as normal. I've never been against people transitioning. I'm just against young kids making decisions, or their parents making decisions on their behalf. I couldn't, as a parent, make a decision like that on behalf of my children. Now, how do you talk to a 12-year-old about the implications of their treatment for when they're 25, when they may feel like a completely different person?
The clinic, however, denies the accusations, claiming a high level of satisfaction from patients. Despite the controversy around the treatment, the number of referrals to this clinic has increased exponentially in recent years. Mark Evans again believes the topic of gender dysphoria has become highly politicised and the well-being of patients is overlooked.
There's something about this area that is highly politicised, which means there's a sort of feeling you can't ask questions or you're accused of being transphobic. And actually, normal medical practice is not taking place, in my view. There's not enough research, there's not enough interest in the downside of what's going on. There's not enough scrutiny of the issue of consent. And I think we need an independent regulatory body that would oversee this controversial area. And my view is the trust is too involved with the pro-trans lobbies. It's not. I don't think it necessarily realises to what extent the political forces are driving what's going on in this area.